Good morning. I'm Dave Wolf, President of the Indiana Dental Association, and I have Megan Lohman with me this morning. Megan is the co-founder and CEO of Plan Forward, and I'm going to ask Megan a little bit about her background, and then we'll talk about how you got into the business, if that's okay, and then finally I'd like for you to get into some nuts and bolts and details about Plan Forward and how it can help our member dentists. So just to start off, why don't you tell us a little bit about yourself and some background, Megan?
Yeah, well, thank you so much for having me.
You're welcome.
It's always exciting to be part of the IDA and supporting your members. Being here, based in Indiana, that's really where our heart is, so really appreciate the opportunity.
Happy you're here.
Well, I'm from Indiana. I'm from Fort Wayne, went to Indiana University in Bloomington. Started my career actually in medical sales and
really?
had positions actually kind of around the country, but landed back in Indianapolis and really just tripped into the dental industry. So now I live in Westfield, so just north of the city. I have 2 kids. Henry is 6 and Leah is 5.
Oh, you're a busy lady.
Yeah, and I have a German Shepherd, so yeah, that's me.
So, did you always have aspirations to be an entrepreneur, to start your own business?
No. If you would have asked me, when I came out of college or even in college, I think had I thought I could afford med school, I was always very like math and science. I was going to go to med school and then figured I couldn't afford that. So then I was going to go to physical therapy school and did some internships in college, thankfully, and decided that was not my career path. So I took the position in medical sales.
Mm-hmm.
And so business was never something that I was attracted to. And so this whole entrepreneurial journey has just been so challenging and has pushed me, and I've learned so much. And I can really say that I love business. That is just really where I've landed, and I've really just kind of found my calling.
So how did you get affiliated in the dental industry?
Great question. So I was making a career transition. I was working at I was the first employee of a startup, which was a marketing agency. And long story short, I was traveling. I was on a plane all the time, every 5 to 7 days, traveling all around the country. And that just wasn't going to work for getting married and starting a family. So I was actually thinking about going into education. I was like, maybe I want to teach math. And at that time, Dr. Flanagan's receptionist, I had worked with his wife, and I was friends with the family, and we were talking, and she said, you know what? Jason's receptionist just left for another opportunity, and she knew I was exploring another career. She said, why don't you just answer phones in Jason's office until he finds someone who's a perfect fit, or you find whatever you want to do. So it's supposed to be a very temporary thing. So that's honestly how I landed in Jason's front office, answering phones and learning EagleSoft.
Wow.
Yeah.
So how did this membership plan idea come about?
It was truly out of a need for patients. This was back, I can't believe it's been already this long, like 2012, 2013, when they were talking about the implementation of the Affordable Care Act.
Mm-hmm.
And so then they pushed it, and so they enforced it, I think January 1 of 2013, maybe 2014. And so patients' benefits changed. And if you remember kind of in the practice at that time, everybody was confused about benefits. We didn't know where to send claims. The whole insurance industry was just kind of a mess at that time. But especially patients, they didn't know what this exchange was. If employers had changed their dental benefit offering, they didn't know, where they should look or what they should buy. And so really I was the financial coordinator at that time, and I was fielding these questions from patients.
Mm-hmm.
And Dr. Flanagan and I just got to talking, and it really, anyone who knows dental insurance and how it works for patients and providers would know that it is not the best investment of your dollars. If an employer is not paying for your premium, it's just best to pay the dentist directly for the services. And so that's what Dr. Flanagan and I did. We created this plan because people needed an option and they were confused by what was available to them. So we structured it so that it was a monthly payment. We switched our credit card processor, so it was one that did recurring payments, and we typed up a member agreement and some marketing materials, and we rolled it out. And we started telling patients, hey, we've got this solution. If you're confused, what about this? And it just really grew organically.
So how did that process, because that was in Jason's office,
Yeah.
how did this whole entrepreneurial new business, your CEO now, how did that all come about? What was that transition like?
So the plan grew on its own while the team was on board and we were offering it to patients, and so our participation really increased to the point where it was difficult to manage in the practice, and it just became time consuming. And I actually left the practice when I had my second child, and so I was a stay-at-home mom for a year. And that's when Dr. Flanagan called and said, hey, this membership plan is wonderful, we love it, it's doing all these great things, for the practice, but it's getting to be a pain and it's getting to be really time consuming. Can you find something out there that can organize this, like a software? And I was like, sure, I'm sure something's out there. So that was in the fall of 2017. That's really what started our market research to dive in to see, what is out there, what's available, what's the need, and could we find something specifically for his practice? And then that really, from that research experience, plus his exposure into things like the Indiana Dental Association and the ADA, and just he knew what the demand was and the interest was from the dental community.
I agree.
And it really seemed that there wasn't a great resource for helping dentists figure out how to offer this. Is it legal? What's the best way to structure it? How do I manage it in my practice management system? And we had kind of figured all of that out. So we put a business plan together and decided, what? We think we can do this the best. And so we found some software developers and built the software and went to market.
Yeah, I think you've come up with a good product.
Thank you.
So if there was a dentist or anyone, I guess, they had an idea to create a concept, what advice do you have from this learning experience?
Oh my gosh. There are a million things you're not going to know. And there are 10 million reasons why you shouldn't do it. But if you're convicted that, if you're compelled and you're just persistent in asking people and asking questions and being open to feedback, and you find people who know what you don't know, you'll get there. So don't be afraid by everything you don't know and where the money's going to come from, and don't be afraid of that, but almost be motivated by that. And if you're open to the challenge, I mean, it is a grind, but there are so many people. I think the book I'm going to write is going to be The Power of a Cup of Coffee. So nobody steal that title.
I like that.
Because
I want an autographed copy, by the way.
Okay, you can have the first one because
All
we talked to you first about this. So many people are willing to offer advice and to give you feedback and to open their network. Just if you say, hey, Dr. Wolf, do you have an hour one day where I can buy you a cup of coffee? People will do it, and they're happy to talk about their experience and open their networks, and especially in the Midwest, that's what we have going for us. People are really genuine.
I agree.
So I think, don't be afraid and just put one foot in front of the other, and always plan for the next 6 months. Try not to think about the next 6 years, because that gets way too overwhelming.
So what was your first day like when you started this new business?
Well, I did have 2 kids and I was a stay-at-home mom. So the first challenge was, how do I carve out time
Sure.
to do this? And to be honest, we didn't necessarily have the money to pay for childcare. So for the first 90 days, we had our moms, my mom and my mother-in-law, alternate. I put them literally on like a schedule, and they would come down. They're both from a few hours away, and they would come down and they would watch our kids while I worked 2 solid days. And so day one, I went and I met with, I had one meeting with the software developer, and we kind of formalized what our first scope of work was. And then I went to a co-working space and I bought a membership for $75 a month, I think.
Really?
And I started the company out of a backpack. And when my mom or mother-in-law was with my kids, I would go to this co-working space and just figure out, okay, what do we need to do? First, we need to build the software. Okay, well, we need operating agreements. We need all just kind of mapped out. What do we need in the next couple months? And it just one thing.
That's a great story. You're determined. I'm impressed.
Thank you. And then we needed, beta test sites. So we're like, okay, we have to start talking to dentists about this. Who would be willing to let us gamble with, this idea? And only
Sure.
the brave were willing.
So now 3 years later, what have you learned from this whole process?
I've really learned how valuable, honestly, these membership plans can be for patients. There's a massive need, but for dentists, there is a massive opportunity if you want it. And insurance isn't going away. As I talk to dentists all over the country, I've literally had thousands of conversations. It is probably the number one pain point for dentists and their teams is dealing with insurance, figuring out reimbursement rates. What should my pricing be? And it's all because of insurance. And the value to patients is flat at best, certainly not getting any better. And so there's just such an opportunity to get excited about the thought of having a direct relationship with your patients and helping patients have a comprehensive preventive plan that you can include everything that you think a patient should have for your optimal standard of care, and they know exactly what they're paying for that and exactly what they're getting. And if they need something else, they know they're a member, so they get a perk, they get a discount. And some dentists don't like that word discount, and I get it, but consumers love discounts and consumers love to save money. So if you can show them that, hey, we have you covered, we have everything you need in this plan, and you know exactly what you're paying every month or every year, and we're going to take care of you. And if you need something else, you're also going to save money. That's the most transparent, simple, low overhead patient you could deal with.
In my practice, because we've been thought about this for a long time until you came along.
Well, Pam did.
Yeah.
Pam, not to interrupt you, she had a manila folder. She
We've
brought
been
it to our
collecting
first
information for some time.
Yeah.
Trying to figure out, and it's just so time consuming. And that's when you were talking about, carving out time to develop this. In a busy practice, I don't think most dentists have that time to focus like that to develop it on their own.
Yeah.
So it's nice to have the package that someone's done the research and it works.
Yeah. And I'm just so appreciative that you were willing to be one of those beta customers, because we've really streamlined the process since then. So it's so smooth. I mean, dentists show up with their standard fees. We crank out a pricing call, we give them, and we've gathered 3 years plus our previous 5 years in Dr. Flanagan's practice of fine-tuning the best methodology of how do we package this, what are patients accepting best. Now we have thousands of patients and we're 27 states, I think.
No kidding.
We have a lot of data to know what plans grow the best and where the pricing lies and where where would we advise setting the pricing. And so we just recommend it. You approve your marketing materials, we train your team in a live training, and you have a support person. So if you have questions, we're super responsive, and we're just there to support your team because we know you don't have time.
Right. Yeah, that's appreciated. You do a good job of that.
Thank you.
Thank you.
Yeah, you're welcome.
So what have been the biggest challenges over the past 3 years?
Oh, the biggest challenges. Getting a hold of dentists you know?
We're all busy and don't answer our phones.
Exactly,
We
and
don't want to be interrupted.
I don't blame you, because what you're doing is important and you are busy. The inside of a practice is patients nonstop. Everyone's interrupted constantly. I was the gatekeeper for all the salespeople that called, so I get it. But honestly, I think there's an interest and an appetite to learn more about this, but the biggest challenge is helping the dentist and their team understand that this is a value that will help your patients, and it will streamline things when your patients don't have insurance. If you can give us 2 hours together over the course of 2 weeks to just make some decisions, but getting that focus and that attention from the dentist is probably the biggest challenge.
Good answer. In our practice, I think what's helped the most is we have so many people, when they retire, they lose their insurance. And so they've been coming for years, they love our office, and then they lose their insurance, and then they come in and they say, well, we don't want to do x-rays now, that's not covered, we don't want to do that, that's not covered. And then when we present the loyalty plan and they're getting their ideal treatment that they're used to, and you're able to take those x-rays that are routine, and you're still finding recurring problems that you can catch and take care of, and then they know they're going to get a discount on their service, they really value it and appreciate it. So we've had, I think that's the biggest group of patients in our patient pool, are those retirees that want to continue to, they want to maintain their teeth because they've had good insurance and taken care of their teeth all their life, and they don't want to end that. But at the same time, they don't have the same income and they don't have insurance, and they're trying to cut corners. So offering this plan makes total sense to them. It's a very easy sell.
Yeah, it really is, especially for the retiree group, because the options available to retirees, if they're adding some sort of Medicare supplement, it is so confusing.
Mm-hmm.
And they think they're buying one thing. And I was in the practice, and I can relate to every financial coordinator and office manager that when this person buys this plan, spends their money that's limited on this plan that might be $40 a month, $50 a month, and then they come to the checkout or they get their EOB and it hardly covers anything, and they're still paying out of pocket, they're frustrated. And sometimes that frustration gets taken out on the staff.
It does.
And that's really unfortunate. So hopefully you get the retirees before they waste their money on some of these supplemental plans, but because they feel like they've been burned, when you can just tell them, hey, everything's included and this is exactly what it's going to cost, it's not confusing. They know what they're paying and they know what they're getting. I mean, I would say people almost pay a premium for that, just for the transparency.
The other group that we have in the office that I think really appreciate are those small business owners that can't afford dental insurance to purchase for themselves or for their small staffs. And
Yep.
It's a good program.
Yep,
for that
absolutely.
segment.
Yep, absolutely. I mean, we're still a small business, and luckily our team go to dentists who are now customers.
That's
and
awesome.
so we pay for their membership plans. And we actually, if they have issues, we look at what treatment is being proposed and reimburse them for a portion of their treatment. So there
Nice.
are lots of ways to still offer a benefit as a small business owner to your employees, especially through these membership plans.
So now you're a business owner, CEO, much like every dentist. What do you enjoy the most? What makes you happy doing this now?
Gosh, I love the thought of building, and I love the challenge of seeing where it goes and getting creative. Where my passion lies is the customer journey, right?
Mhm.
I want to know how we can improve this platform and how we can streamline this process and how we can make this available to as many people as possible, as quickly as possible. So for me, I love the thought of scale. And
Mhm.
so how do we take this experience and keep it very provider focused? That's always going to be our goal. We're a B2B to C sell. We sell to dentists who sell to the consumer. And so that can be a challenge to make all of that streamlined. But that's what I love. I love learning from the office managers and the dentists on, if we just had this flyer to show the comparison, or if we just had this step-by-step thing, this makes it easier, or if this button just did that, that's where my passion lies, is really figuring out how to streamline this, to make it simple, to then dump some rocket fuel on it, to then scale it.
Well, you've done pretty well being in multiple states in just 3 years, so
Yeah,
congratulations.
thank you. Thanks
That's awesome. So tell us, there's other membership plans available out there.
Mhm.
Why would Indiana Dentist want to choose your plan forward?
Yeah, that's a great question. Because you get to work with such an awesome team. That's obviously number one. No, I think even if you read our Google reviews or talked with anyone on our team, I think the expertise that we bring compared to any other membership company out there, we are number one, most focused on this plan being profitable for your business. You have to know that you're making money on these plans. And you have to know how to measure that, because if you don't, then you don't know what to tweak, you don't know what to increase, and you don't even know if you should be offering it, right? So from that implementation and us helping guide the pricing is probably what people appreciate the most. Everything we deliver to you is white labeled. So Plan Forward is essentially invisible to your patients. It truly is your plan. The merchant account that charges, your patients is yours. So they're seeing Wolf Family Dentistry on their credit card statement. I mean, it truly is the relationship between you and the patient, and the support. You have a dedicated person that that every time your team has to call them, or if they have questions, or if you want to improve your strategy or change your strategy on how to grow, you know who you're calling. You're not calling into like a call center. And just the implementation, like I said, over the course of 3 years, we have really streamlined this process. So it's like 3 steps, and it's super simple to implement, and we'll kind of hold your hand.
I agree.
all the way.
You made it easy for our office and for our staff.
Thank you. Well, good. And you were the first. So.
And we have 3 full-time equivalent front desk, and I would say half of that time is spent dealing with insurance companies and explaining insurance and calling and following up, and it's a courtesy to our patients, and they don't always realize that because we don't have to do that, but the average Joe Blow doesn't understand the intricacies of filing insurance and claim numbers and all that stuff. So you do it as a courtesy, but sometimes they get frustrated when it doesn't pay. But Plan Forward, when people hear that, it's easy to understand. It makes sense to them. Mm-hmm. So
I would be interested to. I should call your front desk team to see if they could somehow quantify how much time they've saved by having a plan already available, and that streamlines that conversation for that uninsured patient.
Mm-hmm.
So if an uninsured patient brought your front desk team, 2 or 3 plans that they're evaluating,
right.
Now your team would probably say, you know what, this is our plan and this is our best recommendation. And so it streamlines. We're not gonna be your insurance expert because we don't know how this is gonna pay in our office, and this is our best recommendation for you.
Mm-hmm.
So for every single patient that asks about that, or I'm getting ready to retire, or I just got divorced, or I just moved here, my job changed, this is now the best recommendation, and your team no longer feels like they have to be the insurance expert for people who are searching and shopping. But to your point, if they are insured and you are following up on claims and things do get denied, that's not going away. It's still never. Yeah, the patients still expect the team, the dental team, to be their insurance expert and advocate.
So what opportunities do you see for dental practices using membership plans in the future?
Oh my gosh. I am obviously biased, but I just think there is such an opportunity to get creative with who you approach about these plans. There are a lot. I know nobody wants I remember you saying this originally. You thought you were going to have some massive marketing strategy to roll this out to actually help have it grow. And it doesn't have to be that way. It can be simple. But if you really want to take advantage of the resources out there, you can get creative with social media and Google Ads and create ads around uninsured patients. And they're estimating 50% of adults are uninsured. And so that's a huge population.
Huge market.
Huge market. So insurance, and that's not going away, but neither is this uninsured patient pool segment, right? And they're probably not the ones walking into your door all the time. So to kind of put on that entrepreneurial hat for dentists and maybe use, it's going to be a little bit of an investment originally, but finding some market. We have a marketer actually that we're just rolling out this partnership, which is super exciting, with a company called Legwork. They're a growth marketing platform for dental practices, and they will create a marketing strategy for you and do social media geo-targeting and run ads and build ads specifically for dental practices and put lead generation tools on your website so that your website's actually not just a brochure, but talking to people who don't have insurance and bringing them in and getting their leads. And then there's so many things you can do if you turn on that, okay, time to grow my practice. How do I do it? I need to market and actually leverage this plan. It doesn't take that many patients to really create a return and some cash flow for a dental practice. So I just think there's a great opportunity.
I agree. I hope that we have a lot of young dentists that are listeners to incorporate this in their practice early. It can make a big difference in the growth of the practice.
You have a really well-established, very loyal patient base in your practice. But for the younger dentists who are maybe starting out, one of our advisors is the president of a national insurance company, and he handles employer plans.
Mm-hmm.
So he goes into the employers and helps package medical, dental, vision, whatever the employer wants in a plan, and that's their benefit offering for employees. He was telling us that there is a shifting trend in younger, we have a huge diverse workforce, but there's a shifting trend, especially for younger employees, probably 45 and under, that everything outside of major medical, they still want the funds. So employees still want those benefit dollars, but instead of having the Delta Dental plan or Anthem, 300 plan, they would rather have those funds in an HSA where they can use those pre-tax dollars to choose my dentist who has the membership plan, or to choose my eye doctor or mental health provider, whatever it is. It's shifting. So the younger generation who is a big significant portion of the workforce, so you have the retirees who all can benefit from it, but these people with loaded HSA funds that can be used to pay for these membership plans is where the trend is shifting. So
interesting.
Yeah, I think that's really something younger dentists should keep in mind, and the how people want convenience and they want technology and they want click to pay, click to schedule, subscription. That's really kind of where the market is going. So just trying to stay in that and to stay ahead of that, I think will give you a competitive edge.
So anything that I haven't asked you, or any last thoughts? We've had a nice discussion. Is there anything else that you'd like to share with our listeners?
Get a membership plan. If you don't have one, implement one. It's simple, and there's a way that if you get one membership patient, it pays for your investment. So there's just a way to really structure it so that it's truly beneficial for everyone. But and also, if you're an entrepreneur, don't be afraid to take the challenge. It's a ride. And just thanks again for the opportunity.
Oh, you're welcome. You're very welcome. I want you to give your contact information if listeners have an interest in Plan Forward or want more information. Tell them how to get a hold of you.
You're welcome to email me directly all the time. I'm M. Lohman, Lohman, at planforward.io. That's my email. Our website is planforward.io, and we're on all the social media channels.
Great.
At Team Plan Forward.
Okay. Well, thanks so much for your time today, Megan. I've enjoyed talking to you, and you're providing a great service for dentists, and I appreciate what you've done for our practice, and what you offer to the dentists here in Indiana.
Thank you. Thanks so much.
All right, have a great afternoon.